Hi, my name is Rebecca Priest, and this is my sterile dressing change with the CVAD. First, I'm going to knock on the patient's room, do hand hygiene, walk in and present myself. Hi, my name is Rebecca. I'll be your nurse today. I'm in here to change your sterile dressing with your CVAD. Can you identify your name and date of birth for me? Great, that's awesome. Then first, I'm going to put my mask on. Gloves. I'm gonna make sure the bear or the person is elevated a little bit, and then I'm gonna ask for their head to turn that way. Can you please turn your head away from the dressing? Great. And then I'm going to remove the sterile dressing. And then if it looks like it's not coming off easy, I can always get an alcohol wipe to help remove it. Alright, and then I'm going to dispose of this. And then I'm going to simply look at the dressing or the catheter. It looks like it's intact. There's no signs of infection, no redness, no edema, no warmth, no swelling, and it looks good. So then now I'm going to take these gloves off, and I'm going to hand hygiene again. And then I'm going to open my sterile dressing kit sterilely. I'm going to remove that mask. Take my sterile gloves out. Okay, so I just opened my sterile pack, and then now I'm going to sterilely put these gloves on. Oops. Oh shoot, it was in the wrong way. There we go, we can fix it. Perfect. Oh, I broke sterility. But we're gonna act like I didn't break sterility. But for the sake of this video, I broke it. And since I broke sterility, I would just take these off and then get a new pair of sterile gloves. And then that I won't need. Here is the dressing itself, and then the chlorhexidine and the skin adhesive. So first, and the steri strips as well. So I'll use the steri strips, the transparent dressing, and then the name and date. So then first, I would break this open, but for the sake of this video, I'm just going to keep it like this. I'm going to grab the chlorhexidine, and then I'm going to do a vertical and a horizontal scrub. And I'm going to do this for about 30 seconds. So I'm going to kind of get everywhere. And then I'm also going to do the tube. And try not to pull on it that much. Alright, great. And throw this away. And then I'm going to grab this. And this is the adhesive. So I'm going to act like I'm taking it out. And then I'm just going to go around the skin. And this will help with the dressing to stick. Okay, great. So that is done. I'm gonna let that dry for a little bit, and while I'm doing that, I'm gonna take my steri strip and this looks dry now, so then I'm just gonna place that over this device, and then I'm going to grab this, and this is the transparent film. Sticking to me. I don't know why it's so sticky. This is what we can do. So I'm gonna just place it. Make sure it's all intact. That off. Perfect. Take the gloves off. Perform hand hygiene again. And then I'm gonna simply take a pen and this date and time, and I'm gonna date it, and then I'm gonna sign it, and then I'm gonna put it right there. And then once again, hand hygiene. Ask if my patient needs anything. Do you need anything from me before I leave? I'll be back within an hour. No? Okay, great. And then here's your call light. And then just position them comfortably. And we are good to go. Thank you.